Hello friends, welcome back to Complete Medical Coding. Today I'm here with some important more questions. Let's discuss few more questions today, and these questions have been taken from recent question papers, CPC examination papers. Okay, recently, like from 2024 to 2025, like that. So hope this videos will be useful for you. Those who are preparing for the exam. Please, you can use my channel, you can use my videos for your preparation. Okay, it will be very useful. So let's discuss those questions one by one. Moving to the first question. A 35-year-old was diagnosed with stage 1 ductal carcinoma in situ in her right breast. She underwent a localized biopsy of sentinel lymph and axillary nodes in her right breast. An incision was made with a scalpel. Once the glandular tissue of the breast was intercepted, dissection was carried down through the skin and subcutaneous tissue. 1 to 2 centimeters of the breast tissue was dissected free to the lymph node. The incision was carried deep to the right axilla and 2 sentinel and non-sentinel lymph nodes were identified and excised. What CPT code is used to report this procedure? So, here we have to code for the incision, right? Incision is being carried out here. So, what is mentioned on the last sentence? The incision was carried deep. So, it means you have to code for the deep incision. So, the incision was deep to the right axilla and 2 sentinel and non-sentinel lymph nodes were identified and excised. Okay. So, let's move to the codes. Let's find out the code. The description of each and every code. Okay. So, moving to the first option. Option A, 38525. What is 38525? 38525. So, what do you call it? Incision was carried deep to, that is, I'm just reading the last sentence of the question again. The incision was carried deep to the right axilla and 2 sentinel and non-sentinel lymph nodes were identified and excised. So, incision was made and then excision was carried out. Here actually the procedure carried out is excision, and see the second sentence in the question. She underwent a localized biopsy. So, not incision, here you have to quote for the biopsy. Okay. So, she underwent a localized biopsy with excision. That is what you need to find out. Find the answer. And in that, the incision that they made was deep. Okay. So, first option 38525. What is first code? 38525. What is the description for the first one? 38525 is biopsy or excision of lymph nodes, open deep axillary nodes. That is 38525. What is 38570? The second option. 38570 is laparoscopy code. Okay, laparoscopy surgical with retroperitoneal lymph node sampling, also known as biopsy, single or multiple. But this is not a laparoscopic procedure. What is 38500? Option C, 38500 is biopsy or excision of lymph nodes, open, superficial. And option D, 38505 is same, biopsy or excision of lymph nodes by needle, superficial. So, which is the correct answer here? Of course, it's not laparoscopy, so option B is incorrect. You can directly skip option B. From options A, C and D, which is the correct one? Biopsy, excision, biopsy or excision of lymph nodes. Here, since the incision is made deep, you have to code for the D. So, 38525 is the correct CPT code, right? Deep axillary. Sorry. Open and deep axillary nodes. Okay. So, option A is the answer here, 38525, which means biopsy or excision of lymph nodes, open deep axillary nodes. Alright. Moving to the second question. Patient presents with complaints of blood per rectum for the past 3 months. He has not been experiencing significant abdominal pain, but his bowels have been alternating between constipation and diarrhea. The blood is ribbon-like in appearance. Abdominal exam reveals mild tenderness throughout all quadrants. Proctoscopy is performed with 8 cm of interference. Multiple biopsies are taken, unable to pass regular scope. Stricture size scope was advanced past the lesion and visualized the distal rectal mucosa. Digital exam reveals internal hemorrhoids prolapsing. Biopsy sent to lab. Patient scheduled for follow-up visit. Pending pathology report. What CPT and ICD and SIM codes are reported here. Okay. So here you have to code for, here we have to find out both the CPT as well as the ICD. Okay. It will be easy for you if you can find out the CPT or ICD code first. But since we have in the options only one CPT code, almost in 3 options, yes, it is one CPT code. So better we will go first with the CPT codes. Okay. We'll find the CPT code first. So what is the first code? First option, first code 46608. Let's find out that first. 46608. Yeah. And what is the procedure carried out in this question? Even though the question looks a little big, just identify what exactly has been carried out in the question. Okay. As I used to tell every time, skip all those history which is mentioned, or skip all those, the procedure, how it is carried out. Even though some terms will be important, but still just try to find out what exactly has been carried out. Proctoscopy is carried out here. Okay, because the patient is having blood per rectum, and then he doesn't have any other complaints. It's mentioned there. No abdominal pain, nothing. But constipation and diarrhea was there. So proctoscopy is a procedure carried out here. Anyway, let's find out the answer. The CPT code. What is 46608? Option A. 46608 is anoscopy with removal of foreign body. Anoscopy, yes, proctoscopy or anoscopy, both are same. So here 46608 is with removal of foreign body. Nothing in the question mentioned about removal of foreign bodies. Okay. 46611. What is 46611 in option B? Same, anoscopy with removal of single tumor, polyp or other lesion by snare technique. Nothing about snare technique, nothing about removal of polyp or tumor. That's also wrong code. You can skip it out. Option C, 46606. Anoscopy with biopsy, single or multiple. Yes, we need that code. This is with biopsy and single or multiple anoscopy, whatever it is. Because here, I think, yeah, multiple biopsies are taken. In the question, it's mentioned. Multiple biopsies are taken. So, single or multiple biopsy, whatever it is, that is what the code which we need, 46606. If you go to option D, there is one more code, 46600, along with the code which we need, 46606. There is one more code, 46600. What is that? Anoscopy, diagnostic, including collection of specimens by brushing or washing when performed. Just anoscopy is mentioned. Nothing mentioned about biopsy. It is just brushing or washing. No, we need the biopsy code, which is 46606. So even though, so already if it is present, then you don't need to code for the other one. 46600 is not necessary. It's not needed. So as I said, 46606 only we need to code. So you can get the answer, right? Simply as option C, because that is there only in option C. So you don't need to check even for the ICD code. So similarly, you can, during examinations, you can save the time. Okay. Anyway, but in the question, I will just check. We will just check also, even though if you find the answer, just go and check in your ICD code book. What is the, if that ICD which is there in your expected answer, in your expected option, whether that ICD is matching. Just check that also. Okay, so here it is K64.8. If you go and check in ICD code book, you can open ICD code book also. What is K64.8? It's a code for hemorrhoids, other hemorrhoids. Yes, hemorrhoids is the ICD code here. So I said option C is the answer. 46606 is the code for endoscopy with multiple biopsies, single or multiple biopsies. And then K64.8 for the ICD code, other hemorrhoids. Okay. Now moving to the third question. A 55-year-old female presents with right hydronephrosis. A 23 French cystoscope is introduced into the urethra and passed into the bladder. The bladder is carefully inspected and no tumors or stones are visualized. The first reflex urine from the bladder is sent for urine cytology. Then a 6 French access catheter is passed into the right urethral orifice, requiring a 0.35 guide wire to help cannulate the right urethral orifice because of the angulation. There is some stiffness in the intramural portion of the ureter, and then the catheter pops through into a more dilated ureter. Contrast is injected and there are no filling defects, fixed tumors or stones noted. There is mild hydrourethral nephrosis against the bladder. The renal pelvis is barbiturated with saline and the renal pelvis urine is drained and sent to pathology for urine cytology. After the retrograde pyelogram is performed, the access catheter is removed and there is brisk efflux of the contrast and it drains very well. The bladder is then drained and the patient is awakened and transferred in stable condition to the recovery room. Which CPT codes should be reported? Okay, so here this is the same which I had. This is like a case study question. This will comes under case study in examination now. Once they have updated the examination, there is case study questions also. You will get, I think, 4 questions from case study. So this is one among that. But don't keep those questions. You might get, big questions, bigger questions than this. This looks small, but you might get bigger questions than this. Sometimes it could be smaller also, but mostly bigger. So in such cases, you have to extract what, like while reading itself, you can mark it with pencil. What are the exact, what do you call it, procedure, or what exactly you need, that you can just mark it while reading itself. So it will save time. You don't have to go and read it 2-3 times. Okay. Anyway, so that's how you need to do the case studies. You need to do the case study questions. All right. Anyway, let's find out the CPT codes answer here. Okay, so here what is the procedure carried out? The patient is here with hydronephrosis. Cystoscope is inserted, so it means something related to cystoscope, cystoscopy, cystourethropy, something like that will be there. Okay. Let's directly move to the codes. If it's like not much, 2 or 3 codes, you can skip the question. I mean, you can read it once and then go directly to the option also. You can save time in that. Maximum you should take 5 minutes for case study. Per question, 5 minutes is a maximum. Alright, anyway, first option, first question, first code 52005. What is 52005? Cystourethropy with urethral catheterization, with or without irrigation, installation or uretropylography exclusive of radiologic service. 52005. What is 52327? The next option, 52327. Cystourethropy, again, that is the code we need, cystourethropy only. Okay. So cystourethropy including urethral catheterization with subureteric injection of implant material. In our question, if you read it again, you can find out there is nothing mentioned about any injection of implant material. So that is wrong. Option C, 52010, cystourethropy with ejaculatory duct catheterization with or without irrigation, installation or duct radiography exclusive of radiologic service. So cystourethropy with ejaculatory duct catheterization, that is also wrong. Ejaculatory duct catheterization, no, that is wrong. Okay. And option D, 52281. 52281 is cystourethropy with calibration or dilation of urethral stricture or stenosis with or without meatotomy, with or without injection procedure for cystography, male or female. Calibration, so cystourethropy with calibration or dilation of urethral stricture. What is exactly carried out here? Second option, second sentence. 23 French cystoscope is introduced into the urethra and passed into the bladder. Okay, so it means it is urethral catheterization. That catheter is passed into the bladder, introduced into the urethra and passed into the bladder, which means that is a urethral catheterization. So that urethral catheterization comes under 52005, option A. Remaining all is some other catheterization. So you can go directly with option A. And if you see the radiologic, anyway in the description it is mentioned without radiological evidence. And in all the options it is mentioned the same radiological service, 74420. So no need to go and check it because it is already there in all the options, which is marked with modifier 26 to mark it as a professional component. So answer here is option A, 52005. That is for the cystourethropy, okay, with urethral catheterization and along with the radiology code 74420 and modifier 26. Hope you understood. If you have any queries, you can ask me. You can mark it in the comments. Nowadays, I'm not getting time to reply for few comments. I really apologize for that. But I will make sure that I will do it as soon as possible. So, fourth question. Moving to fourth question. A 30-year-old disabled Medicare patient is scheduled for surgery due to what looks like an ovarian mass on the right ovary. On entering the abdomen, the surgeon finds an enlarged ovarian cyst on the right, but the ovary is otherwise normal. The left ovary is necrotic looking. The decision is made based on the patient's age to remove the cyst from the right ovary. He also performs a left salpingo-oophorectomy. Select the codes. So what's the procedure carried out here? 30-year-old disabled Medicare patient is scheduled for surgery due to the ovarian mass. So here salpingo-oophorectomy is the procedure carried out. What does it mean? Salpingo-oophorectomy means removal of fallopian tubes and ovaries. Okay. So that is what we need to find the answer, find the code here. Salpingo-oophorectomy, removal of ovaries and fallopian tube. Okay. What is 58720? Option A. 58720. 58720. Same. Salpingo-oophorectomy. Complete or partial, unilateral or bilateral. The 58720 is the same procedure, that is the same which we need, salpingo-oophorectomy. Unilateral or bilateral, both are mentioned. But here in the option, in the code, it's marked with modifier right. Actually, it is wrong, right? Because on the description of the code, it is mentioned unilateral or bilateral. So in that case, you don't have to mark it with modifier, any modifier. So which means that is wrong. So you can skip option A and you can move to option B, 58925. Yes. What is 58925? 58925 is ovarian cystectomy, unilateral or bilateral? Ovarian cystectomy. And 58720 in option B? 58720 is again same. Salpingo-oophorectomy, complete or partial, unilateral or bilateral? Yes, same. Salpingo-oophorectomy, and it is appended with a modifier 51. You can append it with a modifier 51 to show that it's a multiple procedure. So salpingo-oophorectomy is also carried out, and what else is carried out here? A removal of ovarian mass, ovarian cyst, which is 5892. That is ovarian cystectomy. Yes, cystectomy, removal of ovarian mass on the right ovary. So, but in the code description, it is mentioned as unilateral or bilateral. So, no need to append it with any modifier. It is clearly, anyway, in the question it is right ovary, but no need to mark any modifier because it's mentioned as unilateral or bilateral. That is what we need. Okay. If you go to option C, again, the same code with another code 58700. What is 58700? 58700 is just salpingectomy only, complete or partial. No, we need salpingo-oophorectomy, so that is wrong code. And if you go to option D, 58720 is salpingo-oophorectomy code. And what is 58920? 58920 is 58920 is wedge resection or bisection of ovary. No, this is not wedge resection, this is cystectomy, ovarian cystectomy. So that is also wrong. So you got the correct answer as option B, 58925 for the ovarian cystectomy, because patient is there for ovarian cystectomy. So you have to mark that code first. And then at the end, it is mentioned as he also performs a left salpingo-oophorectomy. He also did that procedure as an additional procedure. So that will come as the second code, 58720. Mark it with modifier 51 to show that it is a multiple procedure. Alright. So option B is the answer. Now moving to one more question, fifth question. An MRI is taken to confirm the diagnosis of a subperiosteal abscess, also called as SPA, subperiosteal abscess, between the orbital bones and left periorbital caused by a staphylococcus infection. The MRI is performed first without contrast material and then followed by contrast materials and further sections. An independent radiologist reads the MRI, confirming the diagnosis. What are the CPT and ICD-10-CM codes reported for the radiologist services? Okay. Here, MRI is the code that we need to find out, the radiological code. And it is carried out initially with first without contrast material, followed by with contrast material. Actually, those questions from radiology is very easy to score marks. Okay. You can easily score marks from radiology part, even though if it comes along with ICD or if it comes only the radiology, whatever it is, it's very easy. But read and understand the question carefully. Anyway, moving directly to first option. Since we have multiple ICD codes, I am going directly with the CPT code. Okay. What is 70542? The first option, first code. 70542 is magnetic resonance imaging, orbit, face and or neck with contrast material. So 70542 is mentioned only with contrast material. So that is wrong. If you go to option B, 70540. 70540, magnetic resonance imaging, orbit, phase and or neck without contrast material. So initially in the question it is without contrast material, yes, but it is followed by contrast material. So what is the next code? 70481. In option B, next code is 70481. What is 70481? Computed tomography, orbit cella with contrast material. It is mentioned as with contrast material. Okay. Okay. And then, so that is also wrong, right? Now, if you go to option C, what is option C? 70543, because we need the code description as initially it is without contrast material and then followed by contrast materials and further sections. So go to option C, 70543, the description of 70543. Yes, magnetic resonance imaging, orbit, phase and net without contrast material followed by contrast material and further sequences. Yes, this is exactly what we need. This is the exact description that is mentioned in the question 70543. Okay, initially without contrast material followed by with contrast material and further sequences. So, and it is appended with modified 26 to mark it as a professional component, because in the question it is mentioned that the radiologist itself reads the MRI confirming the diagnosis. So you have to append it with modifier 26. Okay, and then if you want, you can directly now mark the answer as option C. Otherwise, you can go and check the ICD also. Anyway, I will just check the ICD code. What is H05.022? I'm just checking the ICD code of our expected answer option. Okay, and in option C only I am checking. So H05.022. You can open your ICD code book and go to H05.022. Yes, what is H05.022? Osteomyelitis of left orbit. Osteomyelitis of left orbit. Yes, osteomyelitis of left orbit. You can say that, yeah, because the diagnosis is confirmed between the, what is mentioned in the first option, MRI is taken to confirm the diagnosis of SPA between orbital bones and left periorbital caused by an infection. So yes, H code is osteomyelitis of left orbit. And then what is B95.7? B95.7 is staphylococcus, because it is caused by a staphylococcus infection. So that also you have to mark it according to the ICD guidelines. Caused by the organism also you have to code, right? So staphylococcus. Other staphylococcus as a cause of disease classified elsewhere. Yeah. Staphylococcus code also you need to mark it. Alright. So which makes our answer as option C, 70543 for the MRI code, and mark it with modifier 26 to show that it is a professional component. And then the ICD codes or osteomyelitis of orbit, which is H05.022 and B95.7 for the specified organism, staphylococcus organism, which is mentioned. It is also mentioned in the question, right? Staphylococcus infection, it is mentioned. So that organism also you have to code it, how it is caused. That is as per the ICD guidelines. So as I mentioned, option C is the answer. Okay. So that's it, friends. That's it for today. And please stay tuned for more videos. And thank you so much. See you in the next episode. If you are new to the channel, please support me by subscribing to the channel. Thank you so much. Bye. Take care.